My name is Maria, and I work in the communications department at LivingWorks. LivingWorks is the suicide prevention and awareness education company that created the online suicide prevention program that we'll be talking about today. I'm happy to speak with you from Alberta, where Treaties 6, 7, and 8 were signed, lands with which the Métis share a deep connection. Thanks for joining us on World Suicide Prevention Day. This is a pretty exciting announcement, so we'll get right into it. For reporters on the line, thanks for joining us and for your interest. This is literally a story that can save lives. And for the elected officials, we also have watching the press conference. Thanks for joining and learning about what is happening in the suicide prevention and awareness field. We will hear from our speakers first, then move to the Q&A session. Please note in the chat box when you have a question, and we'll unmute you during the Q&A section. You can just tell us your name, your outlet, and who you would like to direct your question to. This is being recorded to share publicly after, so you can switch to audio only if you don't want to be internet famous. So our first speaker is Ione Chalborn. She's the Executive Director with the Canadian Mental Health Association, Edmonton, and part of the community plan Living Hope, which looks to prevent suicide in Edmonton, and she'll explain further. Ione.
Thank you, Maria, and good morning, everyone. I'm pleased to be here on behalf of Living Hope, a community plan to prevent suicide in Edmonton, and as Executive Director of CMHA-Edmonton region. I would also like to take a moment to acknowledge the traditional land of Treaty 6 territory and the Métis Nation of Alberta zone that I am on today. In 2015, a group of diverse stakeholders came together to consider the prevalence and causes of suicide in Edmonton, and to develop recommendations that would ultimately reduce suicide in our city. This led to the development of a suicide prevention strategy and ultimately the implementation plan that guides our actions in suicide prevention today. Living Hope is an inspiring example of concerted community effort to prevent suicide in Edmonton. It represents a sustained collaboration of many community agencies, government, and the private sector who have shared their experiences, insights, and wisdom. There are three central goals guiding the strategy's implementation plan. The first is to provide awareness and education. The second is to increase access along the whole continuum of services. And the third is to address the needs of higher risk populations. Today, on World Suicide Prevention Day, Living Hope is excited to share the opportunity for Edmontonians to learn how to recognize and respond to people who may be considering suicide by taking the LivingWorks START training. We are offering this online training for free to Edmonton residents in the hopes that together we can increase the collective capacity of Edmontonians to be able to support those who may be at risk of suicide. There are a limited number of online training spots available, and they are offered on a first-come, first-served basis. The ability to offer this and other training is a key element of Living Hope. This is a plan built on the belief that the whole community can play a role in suicide prevention, and that there is a shared responsibility to learn, think, and talk about suicide with compassion and openness. Last year, Living Hope launched our public awareness campaign, 11 of Us. Through this campaign, we share important information with Edmontonians on the warning signs of suicide, suggestions about how to have a conversation about suicide, important community resources, and where to find help. If you have not done so already, I would encourage you to visit 11ofus.ca, where in addition to this information, you will find links to our sponsored suicide prevention training, including the START training. The impact of suicide in our communities is profound. Most, if not all of us, know someone who has died by suicide. Many of us have loved someone whose loss as a result of suicide remains with us for the duration of our lives. But suicide can be preventable. Together we can do something, and together we can make a difference. I call on all of you today on World Suicide Prevention Day and every other day to listen, learn, and take action to help prevent suicide in Edmonton. Thank you.
Thank you. That was Ione Chelborn, Executive Director with CMHA-Edmonton. Ione mentioned the public awareness campaign, 11 of Us. We've included links in the chat room that you can see, and you can easily find them in the news release or after with a quick web search. We're going to play a short video from the campaign so that you can get a little taste of it.
Hi, Dad. Is everything okay?
Excellent. So our next speaker is Ed Mantler. He's the Vice President of Programs and Priorities at the Mental Health Commission of Canada. The MHCC has a unique mandate from the Government of Canada to support federal, provincial, and territorial governments, as well as organizations in the implementation of sound public policy. Ed?
Thank you, Maria, and good morning, everyone. 11 people die by suicide every day in Canada. That's more than 4,000 people every year. I'm so proud that Edmonton, as one of our Roots of Hope communities, is making change by taking action on World Suicide Prevention Day to provide free suicide awareness training to 2,000 individuals. Roots of Hope is a made-in-Canada approach to preventing suicide that has 5 foundational pillars. This launch shows the importance of raising awareness about suicide and highlights the work that Edmonton is undertaking with awareness activities under one of those pillars. Suicide can be prevented. The actions that are happening here in Edmonton today can be brought back to the other communities involved in Roots of Hope so that communities will be able to strengthen their efforts and learn from one another to help prevent suicide in Canada. By offering START training to so many individuals, Edmonton is providing valuable teachings to improve the lives of those who live, work, and study in this incredible community. Congratulations on this great success.
Thank you, Ed. That was Ed Mantler, Vice President of Programs and Priorities at the Mental Health Commission of Canada. Check out the link that we provided in the chat box about Roots of Hope to learn more about it. Our next speaker is Mara Grinnell, Executive Director of the Centre for Suicide Prevention. The CSP is an education centre, and it's also a branch of the Canadian Mental Health Association. Mara? Oh, we'll just have to unmute Mara. There we go. Take 2.
Thank you, Maria. Center for Suicide Prevention's offices are located on Treaty 7 lands. This is the traditional home of the Blackfoot Confederacy, the Tsuut'ina people, and the Sarsi people, as well as the Métis people from Region 3. It's my pleasure to be here with you this morning and to be here with my colleagues because suicide prevention requires collaboration. Everyone has a role to play. As Ed just told us, more than 4,000 people die by suicide in Canada every year. More than 500 of those people are in Alberta. So if your math is quick, you're realizing that this is disproportionate. Alberta has one of the highest provincial suicide rates in our country. Why? While there's no single cause of suicide and no easy way to unwind its complexities, we do know that a constellation of risk factors is usually at play. Alberta is characterized by its boom-bust cycles of male-dominated, lone worker, volatile industries, often leading to social isolation, negative coping strategies, and financial insecurity. Even before the pandemic hit, we were wrestling with our latest economic downturn. Calls to local crisis lines in our province reported more suicide-related calls in 2020 over the same time in 2019. Since COVID, we've only seen those numbers rise. So what do? Crisis calls are not deaths. Suicide is not inevitable. People are struggling and we can help them. We can strengthen our community to support each other. Suicide is complex and there are a few best practices, but education is one of them. And we need to learn how to identify when someone is considering suicide, how to respond, and how to connect them to help. LivingWorks START program makes this learning accessible, and the City of Edmonton has made it available. The people of Edmonton are leading the way with this initiative, and we are proud to be partners.
Thank you, Mara. Now I was on mute. Mara Granau is the Executive Director of the Center for Suicide Prevention. Their website link is very easy to remember, suicideinfo.ca. There are a ton of resources there, including statistics, articles, webinars, and many courses you can take. Our final speaker before we move to the Q&A portion is Rick Trimp. Rick is the CEO of LivingWorks. LivingWorks is an Alberta-based and known LivingWorks is Alberta-based and known globally as the originators of gold standard suicide awareness, prevention, and intervention training such as Safe Talk and Assist. Rick?
Good morning, everyone. It's a pleasure to be here, and it's a pleasure to be part of this exciting initiative in the City of Edmonton. Here at LivingWorks, our mission is to save lives from suicide. We do that by empowering communities of people to work together and to keep others safe. As an Alberta headquartered company, suicide prevention has been our sole focus for over 35 years, and during that time, we worked with thousands of organizations, trained over 3 million people in communities around the world. These communities include education, military, and veterans, among others. We provide our partners with consultation, expertise, and full service training. We are excited to be part of this unique community plan to prevent suicide in Edmonton. This is an essential initiative at a very important time. We've heard about the statistics. We've heard about the importance of a suicide prevention approach in Alberta and the impact that Alberta has. What's particularly valuable about this approach here is that this plan involves all relevant stakeholders. We can't have healthcare professionals on every corner, but we can empower members of our community to come together and to create safety nets for the people in Edmonton. The LivingWorks START program is designed to do exactly that. It empowers people to recognize when somebody is struggling. It gives them the confidence to ask that person directly and to take meaningful steps to connect them to help, to resources, and to keep them safe. Like all LivingWorks programs, LivingWorks START is an evidence-based program and has been effectively tested and is appropriate for those as young as 13 years of age. We believe that this will make a life-saving difference for people in Edmonton, and we are encouraged that the City of Edmonton has taken this initiative by the horns and made a plan and has an action to be able to follow up with that plan. We encourage leaders across our nation to be able to take on the same challenge, and so we look forward to working with those communities as well. Thank you very much for your time this morning.
Thank you, Rick. Rick Trimp is the CEO of LivingWorks. LivingWorks START is the online program that will be offered free to 2,000 people who live, work, or study in Edmonton. Here's a short video to give you more of an idea of what you would learn when you sign up.
How many people count on you each day? Let's take a minute to think about it. How many people know you're there to support them? Your friends, your family members, your coworkers, or even someone you've just met. At work, at home, at play. People count on us for a lot of things. So what if someone was counting on you for help with the biggest issue of all? The fact is, around 1 in 25 people are thinking about suicide at any given time. If one of them needed your help to stay safe and alive, would you know what to do? That's where LivingWorks START comes in. In just 90 minutes, this interactive online training will prepare you with the knowledge and skills to save a life. With engaging simulations and lifetime resources, LivingWorks START is your way to make a world of difference for someone, because you never know who's going to need you. But with LivingWorks START, you'll be prepared.
All right, now it's time for the Q&A, and I'm just looking in the chat room. Does anyone have a question yet? You can just put your name or just in the chat room and I'll unmute you. And if not, I have some questions ready to go, so don't be shy. I'll start off. Ione, I have a question for you to start off with. Can you talk a bit about the story behind how your community plan Living Hope got established?
Sure, happy to. Some years ago, and I think we said it was 2015, there was requests and pretty strong requests by Edmontonians to put barriers on our high-level bridge to help prevent suicides from that bridge. And there were a group of people who were at City Council that day to certainly support the barriers being installed, but to also talk about where is the first place to intervene so that we're not doing prevention at a crisis point. We're starting way upstream. And so with that conversation, City Council took the bold move to start investing in suicide prevention by through developing a framework and then a strategy and then this plan. So our city leaders have been very, very invested in suicide prevention since the outset, and so glad to live in the city where that kind of proactive thinking is an everyday occurrence.
Excellent. So it sounds like leadership is always key.
Leadership is key, yes.
Excellent. All right, next we'll go to Ed. Ed, how does a community get to be part of Roots of Hope?
I will actually toss that question over to my colleague, Carla Thorpe, who is Director with the Mental Health Commission of Canada, and Carla is leading the Roots of Hope program.
Excellent. Carla, you're up.
Great. Thanks very much, Ed. And it's a wonderful question. So as Ed mentioned earlier, we have 8 communities that signed on to be part of the Roots of Hope project about 2 or 3 years ago. We just a number of weeks ago entered the second phase of the projects, and we're now recruiting additional communities across the country who would like to adopt this similar approach to what's been undertaken in Edmonton as well. So we're hoping over the next 4 to 6 months that we'll have another 20 communities or so that will agree to come on board and participate. We have information on our website on how communities can become engaged in this process. And we're really hoping that we'll have some good uptake. We've seen some tremendous results so far in the communities that have been participating to date. And Edmonton is right alongside all those other communities that are doing such fantastic work. So we're very much looking forward to expanding the program.
Well, that's great. Thank you. So next I'll go to Mara. Mara, what impact is COVID having on suicide rates?
Thanks, Maria. So that's an interesting question. It's the question we're all asking. And the truth is we don't have hard data yet, because by the time a death is classified as a suicide and all of the data is released, there's quite a delay. Because it's comprehensive work. So what we do instead is we use proxies, and in normal times we would use proxies of crisis call contacts as well as emergency room presentations. Of course, right now most people are avoiding hospitals, so we've lost that altogether, and so we're relying on our crisis call centers, and Ione would be one of them, in one of the 2 major ones in our province. But we're relying on their data to give us an indication of what's going on in the community. The problem with that, though, is just because crisis calls are up does not mean deaths are up. Crisis calls actually in lots of ways are positive because people are reaching out. You may be reaching out on behalf of somebody else. You may be reaching out for yourself. But the fact that the volume of the calls has gone up so considerably is alarming. So we know that people are struggling. We don't know what the death rate is or what it will be. The other thing too is that suicide prevention is long-term work. And so in a crisis, we may not see an increase in suicide during the crisis. It may still be to come. And why that's really important is because if we shore up intervention now, we can stave that off. And that brings us back to exactly why we're here today, talking about the START program and the Roots of Hope and the Living Hope initiatives in Edmonton and in other places in our country that are strengthening our communities to reach out and help these people.
Definitely, thank you. It's all about groundwork and doing it now. All right, next I'll go to Rick. Rick, why is an online suicide awareness program important right now?
Well, you know, one of the key factors as far as it being right now is that people can't get together necessarily for face-to-face training, which is some of our offerings as well. And so we have this ability to provide a skill-based training online. And so people can take it on their iPad, they can take it on their phone, they can take it on a computer, and they can take it wherever they are. And so it's really, really important that people have that ability to take suicide prevention training. And Maria, you know, one of the most interesting statistics that's been released as part of evidence is that people are 10 times more likely to use their suicide intervention training than they are CPR. And I find that statistic very, very interesting. So our program, LivingWorks START, is a skill-based program. It teaches the skills to be able to identify, to be able to ask the question directly, and how to get that person the resources that they need in order to keep them safe. And so online is a really important modality right now because of the pandemic and with the social distancing requirements and the inability to have face-to-face training. So it's not a second-rate program. It's actually a very evidence-based program, and very timely that we've released this.
Yeah, it's kind of what's needed now, and it's innovative. And so that takes me back to Ed. The Mental Health Commission of Canada leads development and dissemination of programs and tools to support the mental health and wellness of Canadians. What kind of innovations have you seen over the years, things like START or other things that are really kind of starting to make way in mental health?
Question, Marianne, and LivingWorks has been a globally recognized leader in terms of this kind of training with the ASSIST program and now with START. The Mental Health Commission of Canada also really focuses on the importance of mental health awareness and training programs. We offer mental health first aid training to Canadians, as well as a program called The Working Mind, which is aimed at workplace mental health and improving the mental health and resilience of workers. During COVID, certainly the need for that mental health awareness and training has been on the increase. Yet, as Rick points out, providing face-to-face training is simply not possible. So the Commission as well has online training made available, targeting essential workers during the pandemic response, and the uptake of that training has been very, very effective. Thank you.
Excellent, thanks, Ed. So reporters on the line, does anyone have a question? And if not, I'll throw the last question to Ione, and it's a really good one, but you guys might have a better one. Anyone? Anyone? And we can follow up later if anyone wants to interview any of the speakers later, we can arrange that. So Ione, I'll pop the last question to you. What is your message to people in Edmonton and beyond on World Suicide Prevention Day?
Thank you for that question, Maria. My outgoing message would be to learn as much as you can about suicide and how to ask the question if somebody needs help or wants to talk. Learn about the resources in your community and feel very, very confident that you have an important role to play and that everybody can make a difference in preventing suicide.
Excellent. Thank you so much. So thank you to all our speakers and the work you do in the mental health and suicide awareness prevention fields. We'll share a recording of this press conference on our website and via our social platforms afterwards. You can go to livingworks.net and you'll find useful links to all the participants' websites as well. And definitely check out 11ofus.ca. And if you live in Edmonton, sign up for those free LivingWorks Start licenses and learn the proven methods to keep people safe from suicide. If you don't live in Edmonton and think your community should have better access to suicide awareness and prevention training, reach out to your various levels of government. Like the 11 of Us campaign says, learn the signs, looking out for one another is the new normal. Take care, everyone, and stay safe. Thank you.